We're headed over to the Okoboji Wellness Clinic this morning for another edition of Wellness Wednesday. Good morning, Dr. Bradley Meyer.
Hey, good morning, Dave. Great to be with you.
You have a special day going in your life today.
Yes, it's my mom's birthday, so I wanted to send a shout-out to my mom, Barbara Rolfe. She lives in Milford, and she's the one that's kept me going and encouraged me, along with my wife, along the way. When I was going to medical school or thinking about it, my first year at Iowa, my grades were not where they needed to be, and she said, you better get down to business. And so that was a talk we had this summer on a recruiting trip when she worked for Minnesota West, and I got down to business in my sophomore through senior years, and then the rest of the story unfolds. So happy birthday to my mother. She's got the kindest, sweetest heart. Yep. I love her.
Oh, that's awesome. I'm glad the mom had that little talk with you.
Absolutely.
Yeah, very cool. We need to talk a little bit about the clinic. Yesterday, Lene and I, fortunate to be over to the clinic, and one thing that we noticed when we came into the clinic yesterday, we were looking at the license plates, and I told her, I said, wow, look at where all these license plates are from, and people are coming to Okoboji Wellness Clinic near and far.
Oh, yes. This is a fun week. They're always fun, but I love it when we're having folks that return. We do these immersion weeks and sometimes immersion months as we're working to get the body back into balance. And it just happened to line up this week where we had some folks from quite a distance away, and we continue as we talk. We say we go up further on the base camp of the mountain, and we try to get folks further and further along with their help in their journey of health and wellness. But it feels like a family reunion always when folks come back, and it's fun to see folks progress, the progress they've made away from the clinic. And then what's kind of cool is in one case we have our friend from South Carolina. We've added some new parts and pieces. She's come to see us for traumatic brain injury. In fact, I think she might have been on the radio at time a bit, maybe last year, to share her story. But now we've got some more things to work with. And she said she had a pretty significant injury to that brain, that concussion. She's done hyperbaric. She ended up getting a home hyperbaric treatment. She gave herself about an 85-90% improvement. Her husband, Mark, said about 70%, which is significant compared to where she started, where her balance was off and stuttering of words, and she couldn't drive and she couldn't cook. She's doing all those things now, but we like to continue to aim for 100% improvement when at all possible. And so this time she'll be working with Mychal Sheridan, and he does some incredible work with the sensory skills of the body, and we'll be working with the brain as well. He does the reflexive brain work, and then she's at the end of her second week stay here. We'll be doing some ozone, some IV vitamin C, hyperbarics, working with the amazing Janet Gentle that does cranial sacral massage, and Molly Avery that works on the whole body health and nutrition and the digestive tract and the gut. So the whole team is here, and we always and then the end of the finale of the couple weeks, she's going to get a true dose treatment, which is IV PRP. We've talked a little bit about that, Dave, but that therapy there's a support for the brain with that. And as we've talked about in the past, those platelets can go out, and they really bolster the immune system. And what ends up happening with the traumatic brain injury, in her case, it was a car accident a couple of years ago, but you get shearing forces and wounding of that tissue in the brain. So we've worked on it with ozone. We've worked on it with working on her vagal nerve stimulation, hyperbaric therapy, and a multitude of other approaches, neurofeedback, IASIS. But real exciting to see how she progresses. So she'll be coming to see us every 6 to 8 weeks here as she completes 5 to 6 of these treatments. So we'll be seeing more of her on a regular basis. And then we've got some folks up from Des Moines and specifically working on a COVID long-haul case with them. And we got our hands in a lot of different areas, Dave, and this week, even different time zones.
Yeah, and we were just having a lovely visit with a couple in the waiting room yesterday, and I love to get the hope stories, and she was telling me about how she was about ready to go have back surgery, and she gave the, correct me if I'm wrong here on the shot, prolozone, is that how you pronounce it? All right, so she had a prolozone shot, and she said, while not perfect, it certainly is good enough not to be having back surgery. So it was a pretty big deal to her.
Yeah, she and her chiropractor, who's in Cedar Rapids, has been referring up to me ever since. She still sees him, and he does some great work with her. But right now, her main thing is some stiffness in the morning, but the pain is almost completely gone with her low back, which is pretty astounding considering she's got some spinal stenosis, narrowing of that spine, and there was talk of surgery about a year ago. And so a series of the ozone injections that are followed by anti-inflammatory solutions, it's a vitamin mixture, it's been very effective for her. And I think it surprised her chiropractor a little bit because he shared that when we got started, he didn't know anything about it. So he wasn't sure how much that would help, especially if we're at the point where there was talk of surgery. And that's the beautiful part. It's an education process, Dave, to share the good news because, again, I am traditionally trained as an osteopath in the allopathic community and did all that traditional training, got my licenses, went and did my boards and went to residency. But there is a certain amount of information that, again, was not taught to me during that traditional training. And to some degree, even the chiropractors, not everybody's aware of the ozone as much. But that's a part of our job here because the folks in the traditional system that do nothing but traditionals still doing great work there, and we certainly need them, and great when it comes to emergency care. But it's a great space to work together and to be in an education zone where we can both facilitate each other and help each other out and make each other better, because that's what we really want to do for our patients and our guests we want the best for them. However, we can get there in a manner that is logical and scientific and safe and God-inspired and backed by solid research. But it's important to have that dialogue going all the time between clinicians, especially because when I was in the traditional realm only, you're kind of in a hamster wheel and doing prescription, and now I have longer appointment times, and I can look into all these other alternative ways to support some of the traditional stuff and then share the good news, as my patients do as well when they go out and share the good news with their other part of their care teams in other parts of the country.
And one more thing we've got time for, because I know we wanted to talk about the new hyperbaric, some of the new hyperbaric chambers that you have. But one thing I want to bring up, and we had one of your guests on that talked about why she came to Okoboji Wellness Clinic, and one of the reasons was because a lot of these clinics are getting so busy that they specialize in just one thing, like hyperbarics, like ozone,
right,
like True Dose. You're incredibly fortunate. You talk about this all the time, about how you have so many tools in the toolbox, but you are really blessed at Okoboji Wellness Clinic to be able to offer such a wide variety.
Absolutely. This young gal, she's in Texas part of the year. She summers in the Okoboji area with her parents. She travels all over the country for her job, and some of the holistic integrative clinics, even in, say, California or Austin, Texas, or Dallas for that matter, may have super specialized folks in holistic areas, like you were saying, like specifically the brain only, or specifically digestion only, or specifically hyperbarics, or specifically ozone. But there are some clinics out there. We're one of them. I wish there were a lot more. that integrate all of those tools, and it's really refreshing for our guests, our patients to come and have so much in one location, along with a really competent team that's passionate, empathetic, and really believes in the mission. And so I think our guests feel that when they come. Not only do they experience the multitude of options and paths forward that they get to choose from with our direction and consideration, but the feel and the experience that's given off, and that's what our friends from South Carolina shared with me. She's like, it feels very warm and cozy, and on top of that, it's nice not to have to go to this spot for that and this spot for that. We just can take care of a lot right in one spot.
Yeah, now real quick, if you can, give me a little scoop on the new hyperbaric chambers.
Yeah, they're absolutely beautiful. So we're International Hyperbaric Association certified, and we've gotten special training. And so these hyperbaric chambers, it's increased atmospheric pressure, dissolving more oxygen into your body under pressure. So it's equivalent of being around 10 feet underwater. But these chambers are extremely spacious. We give you a pillow blanket service, the best service around. Our team takes great care. They're very quiet, and they're very spacious. You could probably fit 2 or 3 folks in these chambers. We have a huge recliner in each chamber, and folks are able to spread out in there. And again, this spring, we've had a bunch of folks hit their head, some concussions, and they are absolutely loving, because we did transition to these new chambers. They love the spaciousness of them. And so you want to check them out. They look like a submarine almost. A lot of stuff happens under pressure when it comes to hyperbarics and helping these metabolic processes get on track beyond concussion. So excited for folks to come in and try those out. If you're wanting to get going on hyperbaric therapy in particular, we can do a simple hyperbaric consult and get you going on that, because the applications of it are so huge that we can apply it to so many different areas, from a wellness perspective to a chronic disease perspective, that it's very supportive in these areas. It's dumbfounding. One gal that comes from Minnesota, she's like, have dealt with this for many years with traumatic brain injury and brain fog, and she's, why am I just hearing about this now? So she's so excited because she's thinking more clearly. She works with numbers, and she's sharing the good news with as many people as she can. So that's awesome.
That's cool. All right, got to let you go. Before I get into where you're located and the phone number, that lovely couple that we were visiting with yesterday in the waiting area, they wanted us to send a shout out to Janice. I understand Janice listens every week to Wellness Wednesday. We have a lot of people that listen every week to Wellness Wednesday. We appreciate all of our listeners, but a special shout out to Janice here this morning. All right, so where do folks get a hold of you to come see you?
Yeah, we're off Highway 71 in Spirit Lake, just next to Ace Hardware, and 712-339-6024. I do a discovery call it's complimentary, 15 minutes if you have questions about it. I'm just not even sure where to get started, but I'm interested. That's a great place to start. Molly Avery does those. Mychal Sheridan does those as well. And if you're just ready to go and you're like, sign me up, let's get going, you can call and talk to Shauna or Carissa and get that hour-long appointment, and we'll get going. 3305 Berquist Avenue in Spirit Lake.
Very good. All right. Have a great day. Enjoy the day, especially since it's Mom's birthday today. And we'll talk to you again next week.
Thanks, Dave.
All right.
Be well, everyone.
Thank you. Dr. Bradley Meyer at the Okoboji Wellness Clinic. You can find out more at okobojiwellnessclinic.com as well.